Hey everybody, thanks for joining us today. Going to give it a little bit of time here for people to log in, just another minute or two. Appreciate your patience. All right, well, let's go ahead and get started. Thanks everybody for joining us today for Caring for Minors with Black Lung. My name is Willie Dotson. I work for Appalachian Voices. I'm going to share my screen here for a little bit and make a few introductions, and then we'll dive in. So back in August, Appalachian Voices, Black Lung Association, and Appalachian Citizens Law Center hosted a webinar that was kind of an overview policy webinar on Black lung. And when I was doing outreach for that, a handful of college professors and nursing programs contacted me and said, you know, this looks great, but it doesn't fit with our academic calendar. So we've done this one today with that in mind specifically, and we've done some targeted outreach, and quite a few of our registered participants are folks who work in faculty and health professions. So appreciate all y'all being here. And while we will be covering the Black Lung Association, you know, organizing and policy objectives a little bit, most of this webinar is really geared towards information that we think should be of interest to particularly students in those fields. So towards making that possible, we've pulled together a group of folks who are respectively affiliated with the Black Lung Association and or a handful of Black lung clinics and educational institutions. The Black Lung Association has been around for 40 some years now, I think, and it's a chapter-based organization comprised of minors and people close to minors, family and friends and folks who work in clinics. And it advocates for policies that impact minors with Black lung, and also kind of create space for folks who are having this experience to come together and have some fellowship together. The National Coalition of Black Lung and Respiratory Disease Clinics is the organization of folks who work at the clinics across the country, who have similarly done a lot of important lobbying work to ensure that clinics are funded, to ensure that the necessary research is done to diagnose and treat this disease, and has throughout its history worked closely with the Black Lung Association in different capacities. As I said, I work for an organization called Appalachian Voices. This is an organization that's been around for 25 years, most active in Virginia and North Carolina, but also active throughout Appalachia on a number of issues. And over the past 4 years, we've become more and more active in partnership with the Black Lung Association, initially as a local partnership where our office is in Norton, Virginia, with the Southwest Virginia chapter of the Black Lung Association. And it's now grown to where we work with chapters around the region. Our speakers today include a coal miner, a pulmonologist, a claims counselor, and a current and a former Black Lung Program director. So we're gonna hear from each of these panelists that you see on the screen in front of you in this order. And in addition to providing information about the experience of the disease, the diagnosis of the disease, the process of helping minors file claims, the treatment of the disease, and the work that the Black Lung Association and others have done to lobby on this issue. I hope that we'll also kind of get a little bit of some, a personal window into who each of these folks are and what motivates them to do this work. As a community organizer in the region, I have found that the workers at the Black Lung clinics that I've engaged with are, across the board, every single one of them, some of the most incredible community leaders, and they're just really inspiring folks to work with. So I'm really happy that all of you are with us today to hear from these folks. So with that, I want to introduce Dr. Leonard Go. I'm going to stop my screen share for a moment so that y'all can see Dr. Go say hello, and then I'll put the screen share back up to go through your slides. Dr. Go, oh sorry, I put his bio down for a second.
Yeah.
Go ahead. Why don't you introduce yourself, Dr.
No, Willie, didn't you want Mr. Coleman to? I thought the plan was to have.
Oh, I messed it up. You're right. We were going to start with Jerry and then jump to Leonard. Well, I can introduce Jerry Coleman. I know him pretty good. Jerry's a coal miner in Kanawha County, West Virginia, and he does have Black Lung, and he's the president of the Kanawha County Black Lung Association chapter, which is currently one of the largest and most active chapters, and really one of the chapters that a lot of the other chapters kind of look to and rely on for guidance and momentum and all of the work that the association does nationally. So Jerry, the floor is yours.
My name's Jerry Coleman, and I was diagnosed at age 56 with Black Lung, and I worked 37 years in the coal mines. I started in 1970, and I ended up with disabled in 2008. Throughout the years of the coal industry, just the coal dust has got dustier and more dustier than it's ever been. And through our work, all the miners are in dust constantly. And when you run a miner, the shuttle cars, whatever position you got, it's hard to stay out of dust. And, at age 56, you're planning on your retirement. And when you get Black Lung, it changes your whole retirement to you. You can't do the things that normal people can do. I used to love to hunt. I can't hunt no more because I just didn't have the breathing capacity that I should have. I can't play with my grandkids like a lot of people can. People looks at me like, well, there's nothing wrong with you. But through the years of the coal dust and stuff in your lungs, it just gets the best of everyone. And working in the coal mines is a very hard labor job. And we're here to help all the coal miners with Black Lung. And I am the president of Kanawha County Black Lung. And we have an organization that we try to help everyone with Black Lung. We have a monthly meeting, and we have people there that can explain it to you. If you need to fill out anything for Black Lung, we have the clinics to come in. They can sit down with the people with wanting to file for Black Lung if you got any questions about Black Lung. We try to reach out for everybody. And right now, our Black Lung Disability Trust Fund is in a lot of trouble. And we are $5 billion in debt. And December the 31st of 2022, they cut it in half. And that makes us further in debt. Now it's costing us $2.5 million a week that we're losing on the benefits. And that's a lot of money, to lose. And we're going to have help with everyone to get our disability trust fund back. And all the coal miners, we have 7 chapters in West Virginia. We've got some in Virginia, some in Kentucky. We try to work together on each one of these topics. We've tried to reach out the pension a couple of times. It didn't help us. And we're still trying, but we just don't sit back. We fight for everything we got. We've been Zooming over the years with the COVID. And we just work hard and try to help each and every person with black lung. And that's about all I got to say.
Thanks, Jerry. Just to clarify for folks, Jerry was talking about the trust fund. This is the federal program that funds disability benefits and medical care for miners with black lung when the companies that they worked for are no longer able to pay for that, as is happening more and more with the coal industry kind of in decline, at least in our region. Jerry, could I get you to say a little bit more about what you and other folks in the Black Lung Association have done in terms of going to Washington to talk with legislators about that issue over the years and how that has gone?
3 years ago, when we could go to Washington, we went to Senator Manchin's office, and we got the opportunity, to go down to the round table where they had a discussion. And Manchin said that, he was going to help us. This year, before it was cut, he had a 10-year extension. And the Build Back Better plan had a 4-year extension, but neither one of them got passed. And when we went to Washington, I know y'all seen that picture with black lung kills. And there was 3 busloads of us walking around in the Capitol with them shirts on. And it got a lot of attention. And we was going to take a picture in the center of the Capitol. And by the time we getting ready to take a picture, the police there broke us up and wouldn't let us take a picture in there. But, we tried to reach out with the senators, anybody we can talk to, try to get them to understand, the people with black lung just can't afford their medication without the way it's been cut. If we just lived on Social Security, we couldn't make it. If you had to buy your drugs, go to your places for your doctor's visits, we wouldn't go. We're asking Manchin, Capito, and all the other people, to hurry up and get this extension put through to help all of us. Thank you.
Thanks, Jerry. I got one more question I want to put to you. Would you mind talking a little bit about how you first got involved with the Black Lung Association and kind of what the role of the clinics of your local clinic is in your work with the Black Lung Association?
Black Lung Association and the clinics, we all work together. And the clinics will send people to us. We'll send people from our chapter to the clinics. It takes a combined people to work together. And we have got a good group of people. The clinics, while they're there, they can tell them what time they can come to take their test them. And whatever it takes, we're going to try to help each person that's entitled to black lung get their black lung. And our clinics is very good about helping us. We have lawyers sometimes that comes in there to help us. We got other people that visits that come in and that talk about the black lung. You know, I'm sitting here talking about black lung, and I'd say 90% of the people's never heard of it. Don't know what it does to you. It's like I said, it deprived me in my later years as far as retirement. And it's something, a disease that is slowly, but it will get you. You know, it doesn't get better, it gets worse. And over the years, you know, mine's got so bad, I can hardly cut the grass. I mean, you can't play with your grandkids or nothing. And that's all I got, Willie, unless you got something else.
Thank you so much, Jerry. I should have said this at the top, but folks, if anyone has any questions, we'll put a Q&A at the end, but just feel free to drop questions in the chat box there, and I'll take note of them, and we'll address as many questions as we can at the end. So if you have questions for Jerry or for any of the other folks as we go forward, just drop those in the chat box. Jerry, again, thank you so much. And so next up, we're going to talk to Dr. Leonard Go. Dr. Go is a pulmonologist on the faculty of the University of Illinois, Chicago School of Public Health and Northwestern Medicine. And his clinical and research interests are in mineral dust lung diseases, especially black lung. And we're very lucky to have him with us today. And Dr. Go, the floor is yours.
Pleasure's mine, Willie. So hi, everyone. So maybe just a little bit of background about me. I was born and raised in Chicago. I have honestly no ties to any coal mining communities, which might lead to the question of why and how I wound up doing this work. So maybe it goes back a little bit of ways. So for me, I grew up in a pretty lower middle class household. A lot of struggles at home financially. So we, as I made my way through, the educational process, I saw that there was this, kind of opportunity to go into medicine, and but then I wanted to reconcile that with, values that I think my parents instilled when I was growing up. So this line of work that I've been doing for 9-10 years now, something like that, is a way to kind of honor that upbringing. So now with that, I'm gonna talk a little bit about black lung as a disease. We'll talk about the spectrum of disease. And Willie, if you wouldn't mind, could you put up the slides? Thank you. And I'll talk a little bit about what I do in my role in the overall disability benefits process. So this is an example of a normal lung, and you can see that this is very nice, fairly clean, spongy looking organ. This happens to be someone's left lung, so you're kind of imagining looking at them from the side. For miners who breathe in excessive amounts of coal dust and coal mine dust, however, you can get pneumoconiosis, which is the medical term for disease. So Willie, if you could go to the next slide. This is an example of simple coal workers pneumoconiosis, and each of those black dots that you see in the larger picture is what's called a nodule. And that's just it's coal dust, but it's also scarring, like the little scar tissue around that dust. And a little bit harder to see are the little white circles that are within those areas. And those are little areas of emphysema. So you not only do you get the scarring, you often get emphysema along with those scars. And in people who have even progression of this disease and continue to breathe in excessive amounts of coal dust, Willie, if you could go to the next slide, you get complicated black lung or complicated pneumoconiosis, otherwise known as progressive massive fibrosis. So you have large scars that kind of bind together. The tissue within that can sometimes basically die, and minor can cough up what essentially winds up being liquefied tissue, and it can leave behind those holes. So those large cavities on the upper portion of the lung, there are holes where there used to be lung tissue. If you notice on the edges of the lung, you see a lot of white space, and that's also emphysema. So you can have emphysema that's independent of the scars of black lung, and that can happen not just in kind of smoking coal miners. We all think of cigarette smoking or tobacco smoking when it comes to emphysema, but it can happen in people who breathe in coal mine dust for years. All right, next slide, please. So for decades, the medical establishment, to our fault and detriment, didn't really recognize that coal miners got black lung and that this was a problem. A lot of this was driven by company doctors, and it was even though in Great Britain in the 30s and 40s there was a lot of this recognition that coal mine dust could cause problems. Here in the U.S., it really there was a lot of resistance about whether this black lung even existed as a disease, and it took unfortunately a disaster and a lot of subsequent action before there was a lot of institutional acceptance of black lung. So this is a picture of the Farmington explosion in West Virginia. I believe it was 1968 or 1969. That then next slide, Willie. That then led to mass demonstrations and strikes by coal miners. So it really took coal miners and families and other advocates to really get the medical establishment to accept this disease. So even though the science was there, there was a lot of resistance. And so in 1969, there was a federal bill that was passed and signed under duress by President Nixon, who then enshrined the federal black lung benefits program. But it was a long road, and it took a lot of worker action for that to actually happen. Next slide. So after that law was passed, there was a decline in black lung disease. And this is data looking at chest x-rays in people who are active coal miners. And if you focus on the black curve, these are the miners who worked at least 25 years. And you can see that in the early 70s, it was around 30%. By the late 1990s, it was below 5%. So that seems like a victory, right? Next slide. And unfortunately, on the way to the present, there was a rise in disease. And so despite the fact that we had these dust regulations that have been active all these past 50 plus years, we still have a fair amount of disease. And what's worse is, next slide, in Central Appalachia, in the states of Kentucky, Virginia, and West Virginia, the rate of disease is much worse, 20% of coal miners. So 1 in 5 active coal miners with at least 25 years of coal mine experience have evidence of the scarring kind of black lung. So that's it's not acceptable, and it's a huge number of people, 1 in 5. All right, next slide. So this is an example of someone who developed black lung more recently. This is in 1992. This was someone who had about 20 years of coal mine employment. And it's hard to see here, but there are little tiny spots, kind of like the example of the lung section that I showed you with the individual black spots. There are little tiny tiny white spots as the way they show up on the X-ray here, kind of scattered throughout both lungs. Next slide. And then 8 years later, you can see that there are scars that are developing, especially in the upper portions of the lungs. You can see these larger white spots, and that's the complicated black lung. And you see it on both sides of both lungs. What's maybe a little bit harder to appreciate is that that scarring is pulling the lung and kind of shrinking the lung basically, and it's pulling at the other organs. So it's actually pulling upward, normal structures in the lung. So there are a couple of structures that are on either side of the heart there that are basically the breathing tubes, the bronchi to each lung, and they're being pulled upward because of the scarring that's up here. That's just kind of pulling on the lung tissue. Next slide. And here, 3 years after that previous chest X-ray, you see even larger scars. So and if you go ahead, next slide. The previous X-ray, the first X-ray, is the one in the bottom left corner, and you can see that there's a whole lot more white in the two lungs, and that's the complicated black lung. So this man had very severe black lung disease, very severe complicated pneumoconiosis. Okay, next slide. Next slide. Oh, I thought I had another slide. Anyway, the one thing I wanted to talk about to finish this part off is that it's not just that scarring kind of black lung that you can develop as a coal miner. There are other diseases that can result from excessive coal mine dust exposure to you. As I mentioned, you can have emphysema, and that's independent of the scarring kind of black lung. You can develop chronic bronchitis just like a smoker can, even if you're not a smoker. You can have what's called lung function decline, and it's just something that we can follow with breathing tests, spirometry. And then there's a kind of scarring disease called pulmonary fibrosis, and that the one that's specific to coal mine dust exposure is one that we call dust-related diffuse fibrosis. So there's a whole range of diseases that can result from coal mine dust exposure. And we think that, at least in part, this is because coal mine dust is not just one thing. It's not just coal. It's, you're breathing silica, you're breathing diesel exhaust, you're breathing other materials in the coal mine atmosphere. And each of these things can have potential effects on lung health. All right, so for the next part of this is, I'm just going to talk very briefly about what I do, and basically what happens for my part is I see coal miners typically in the setting of doing examinations for federal black lung claims, and these are miners who have been referred to me. I actually have chosen our institution to be examined at as part of the Department of Labor program, the U.S. Department of Labor. And I take a history, I do a physical examination, and then we have the miner do a series of tests, and that would include a chest X-ray to see if they have any evidence of that scarring on the lungs. They do a breathing test to measure their lung function. They do exercise tests, and a specific kind of exercise test that we do is called a cardiopulmonary exercise test. And it's actually the kind of exercise test that for example, some endurance athletes wind up doing to measure their lung function and their heart function, and to get an idea of whether they would be able to do their previous coal mining job, because our task is to kind of basically imagine what would happen if we could take the lungs of that miner from today and put them in the lungs, put them in the coal miner in their last year of employment. Could they do their work if they had the lungs that they have today? And so that's the answer. That's the question that we're trying to answer with the different tests. And I will send it over to you, I think, Willie, unless you want me to talk about anything else.
Dr. Go, that was great. I see some good questions coming through the chat. Y'all keep them coming. Gonna just hold them there for the time being. And like I said, we'll wait until the end, unless anything seems like it really makes more sense to go ahead and present it in the course of this, in which case I will. Next up, we got Susie Criss, who is a Black Lungs claims counselor at Cabin Creek Health in West Virginia. She has a bachelor's degree in healthcare services and certified medical assistant with 30 years of experience on both the clinical side and serving a benefits counseling role in Black lung clinics. And Susie, thanks for joining us. The floor is yours.
Thanks, Willie. Hello, everyone. I just wanted to say real quickly, I do have a huge history in my family of coal mining. So I did grow up around it, but I never imagined that I would end up doing this type of work. I started at New River Health in 1991 while I was going to college, and an opening came up in the Black Lung Clinic for a certified medical assistant, and I applied for and got it. It wasn't a huge interest of mine, but I've grown to love it over the years. They needed someone who could understand the medical side of things, but also be able to do legal work. So just to give you a little bit of background, my grandfather was a coal miner. My 3 brothers are involved in the mining industry. My oldest brother is a federal mine inspector. My other brothers were underground coal miners. And then I later became a Black Lung benefits counselor. So you can imagine that the Sunday dinners at my mom's house were quite entertaining. We had a lot of good conversations about, what they should be doing and what we should be doing. So it's been interesting over the years. Leonard mentioned the Farmington accident that in 1968 that killed 78 coal miners in West Virginia. That's when the Black Lung Benefits Act was formed in 1969. But in that program, they came up with methods for people to file for Black Lung benefits, but they made that process so hard that they had to come up with ideas of how to assist coal miners with filing these claims. A federal Black Lung application currently is about 21 pages long. They have to have lots of legal documents in order to file these claims. So it became necessary to be able to train people who would be able to assist these miners with these application processes. So that's how I came to be involved in around 1991. Brenda Marion, who will be speaking later, was one of my mentors, and John Klein, who is now a Black Lung attorney. He only does cases that are for Black Lung. That's how I was trained. So we had to learn about when the miner calls us, what we should instruct them to do, or which way to have them to file a claim. And they have 2 options, and that's through a state program and a federal program, but these programs are very different from each other. So when the miner actually contacts us initially, they've began having symptoms, and that's why they call us. They're getting more short of breath. They're unable to walk as far without having to stop to rest. And we try to screen them and find out, are they still working around us? Do they plan to retire soon? What their schedule's like, and try to decide what would be their best route. We get their initial testing to see where they are as far as their chest x-rays. Does it look like they are positive for Black Lung? We also do spirometries to see where their breathing is at this time. And then we begin the process of filing claims. As I said, the programs are very different. So most states in coal producing states have workers' compensation programs for occupational pneumoconiosis. So they can file a claim in the state. In the state of West Virginia, they can file a workers' comp claim. They do not have, it's not exclusive to coal miners. So anyone with any dust disease, dust exposure on the job can file claims under this program. So if they've been exposed to asbestos, coal, silica, we've had a lot of guys come through and file that have worked for State Road, that drill through rock. We've had guys file who work on brakes and are exposed to asbestos in the brake pads. So they can file under the state workers' comp program. However, there are many deadlines attached to these programs. So if a miner comes to us and they've just stopped working, we want to try to get that claim in West Virginia within 3 years of their date of last exposure. That's the most ideal situation. They have 3 years from the date of last exposure or 3 years from the date that they were notified that they had occupational lung disease. So if they have lung disease and have a little bit of impairment, state programs will award benefits it's a monetary award. So if they get a 10% award, it's a lump sum payment somewhere in the neighborhood of $20,000. And that's paid out to them over like 6 months. They will then have 5 years to reopen that claim, and they would have to establish that their breathing test shows a worsening in their breathing. So in order for us to reopen that claim, we typically advise them to come back every year to have a breathing test so we can monitor their progression of that disease. I typically work with a lot of attorneys on state claims. They help me with keeping up with the deadline process, and we do that testing and forward it on to the attorneys so that they can deal with the private insurance companies who handle these claims in the state. If they are just filing state, there is nominal fees for their filing. They have to pay for the chest x-ray and things like that. So under federal, it's quite different. That entire process is free to the coal miner. They file the claim, and there's never a deadline to file federal. There are, but like I said, it is the application process is a little harder. So we assist them, we bring them in, help them fill out this 20-page application, gather all their legal documents, such as their marriage certificate, birth certificate, pay stubs, W-2s, and we submit those claims to the Department of Labor. The Department of Labor then authorizes them to have an exam. That exam is pretty extensive. And Leonard showed you some slides on what some of that testing looks like, but essentially they have to have a B-reader chest x-ray, a resting and hopefully exercise blood gas study, and a doctor's exam. And that kind of tells us where they are on the disability scale. So on federal black lung, they have to be able to establish that they are totally disabled due to their breathing. As opposed on the state claims, they can have a little bit of impairment and be awarded percentages based on that impairment. So it's much more difficult for a person to get federal benefits because they have to meet the disability standard. So if they do meet the disability standard, we begin our process of building their case. We can order additional testing in support of their claim. We help arrange for them to be represented by a good black lung attorney. I currently use about 3 attorneys who will take my cases and see them through to the end. It is a very adversarial process. So the coal company fights these miners 100% of the time. The only time that we get a break and the coal company does not fight the coal miner is in the case where they have been relieved of all liability through a bankruptcy. And in that case, if the miner files and gets benefits, it's not a long drawn out court case because those funds fall to the Black Lung Disability Trust Fund that Jerry mentioned in his talk earlier, that we are trying to get an extension on to be able to keep that funded. So I've had cases that have lasted a year. I've had cases that have lasted 10 years. So it can last a really long time. The minor gets dragged to court. They get deposed over the telephone. They get sent for additional testing by a physician that's paid by the coal company. And it's quite stressful for the minor. Like I said, it is a long, drawn out process. And ultimately, at the end of that, if they end up losing their case, there's a little possibility they may have to pay back any funds that were paid to them through this process. So it's just my job as a Black lung benefits counselor to assist them with anything that they don't understand through that process. They get bombarded with legal letters and documents that are hard for people with education, college educations to understand. And it's so we just try to help them work through that process. Many times I've told the minor, if you get anything you don't understand, please bring it to me. I'll help you with it. They go to their post office box about 10 o'clock in the morning, and then they're in my office by 11 to get help with that letter. So that's what we do. If anything that they need through this process, we help them. We help them gather medical records or anything that's needed. We make phone calls to insurance companies and get them set up with attorneys to help them carry forth the rest of the case. Okay, Willie, I will turn it back to you.
Thank you so much, Susie.
You're welcome.
Next up, we have Debbie Johnson. Debbie Johnson is the Black Lung Program Director at Bluestone Health in Princeton, West Virginia. As a licensed practical nurse by training, does a lot of, as I understand, fills a lot of the similar roles as Susie does. But Debbie was going to speak with us today about what the nurses in her clinic and the clinic system, the role that the nurses fill specifically, as well, if you would, Debbie, with kind of your personal connection to what really drives you to do this work. You're still muted, Debbie.
Okay, so I've been with Bluestone for about 25 years now, and for the last 22, I've done the Black Lung program. I guess what piqued my interest is my husband's a coal miner. He's a 36-year miner. He's now disabled. He has complicated PMF. So I know the struggle is real. We also do the state and federal claims. We work on all that, but I think my particular interest is the health and well-being. Amanda's the one that does most of the federal and state stuff. She's my right arm, and she's the fighter out of the two of us. So she's really good with that. So with her doing that, I get to concentrate on the patient and their health. So when we get them in, a lot of times they're coming through to file a state or federal claim, but they don't have a family physician and they need medications. So we still do the spirometries, chest x-rays and B readings so that we can get the answers of where they are and what's going on with them. A lot of them become regular patients that come on a 3 or 4 month basis so that they can get the medications that they need. One of the things that we focus on the most is their actual breathing health and what we can do to enhance that in any way that we can. And we all know that there's not a whole lot that can be done. It gets to a point that it is what it is. But we do try to work with different things. There's a machine that we like to use called a Trilogy. And that machine, I'm told, is used to pull off the CO2. I know what it does. I've seen the results of that. So the men have a better quality of life for as long as they can. Been able to pull off that CO2 so that they have a little more energy. They've got them a little more clarity. It just gives them a better quality of life. We also like to use the vest for those who have problems being able to expectorate all that gets caught up in their lungs. And we've had some great results with that. We bring them in every 3 to 4 months to check and see how their medications are working. If what they're on is not working as well anymore, then we can try something different. And as they're coming back in, you know, with their paperwork for their claims and that kind of thing, sometimes they may not have a visit scheduled through the clinic, but if they're sick when they come that day, then we'll go ahead and see them and take care of that. We all pretty much do the same thing, but I enjoy the fact that these are all good people and they all need help. So we try really hard to make sure that their quality of life is taken care of as the best we can assist them with it, and work on their claims and stuff as well. And that's about all I've got to say.
I've got something I'd like to put you on the spot with Debbie, if you don't mind. Would you mind going in a little bit to some of the common prescriptions that folks end up on? And I, you know, as we all know who are in this work in any capacity, it's not a curable disease. It's just a disease that you work to mitigate. Could you talk a little bit about some of the medicines that folks take and what they do to kind of try to help mitigate the effect of the disease?
Okay, so just about every coal miner has an albuterol inhaler that they carry in the pocket for light respiratory distress when they get out here doing too much walking or too much lifting. About all of them have that. We encourage them to use some kind of long-acting medications, a once or twice daily type thing that helps keep them at a good pace with their breathing so that they don't have to use that albuterol inhaler that much. I really like the nebulizer machine because even though there's albuterol in that inhaler, I think when they do the breathing treatments, sometimes it helps loosen those secretions to where they can get that up a little better and clear their lungs out some. There's all kinds of breathing medications out there right now, and they're all so expensive that none of them can afford them. You know, those little inhalers are $300, $400, $500 a piece. And it's really hard for them to try to get that. Federal Black Lung sometimes pays for that, sometimes they don't. State Black Lung with a 30% or above award is supposed to pay for that. And a lot of what we see right now is if they have a 30% award or better from the state, and then they have their federal, there's a war between the state and the federal as to who is responsible for the breathing health of that miner. And that's a big deal sometimes when you're trying to get those products that helps their quality of life paid for by that miner.
Thanks, Debbie. More good questions coming in, and I'm kind of taking note of some that are popping up for me as well. But let's go ahead and go to our final speaker, and then we'll get to our Q&A. Brenda Halsey-Marion is a registered nurse by training, and she's the former director of the New River Breathing Center in West Virginia. And for a number of years, Brenda was a real leader in organizing with the Black Lung Association and doing some work between the Black Lung Association and the clinics. And so she's going to speak with us a bit today, kind of from the organizing side, from being a clinic worker who has also done this sort of organizing work. And as with everyone else, Brenda, I'd love to hear a little bit about kind of your personal story and how you got into this work.
Okay, it says the host has asked you to start your video.
You're fine. Just go ahead and start speaking.
Oh, okay, thanks. Thank you for inviting me. I'm outside, so if the bees and the dogs and the cats come into picture, don't pay any attention to that. We're having construction. If there's any background noise, I'm very sorry. But I would like, thank you for inviting me to this conversation today. What I would like to tell you is a little bit about my background and how I really got involved with the Black Lung Association and the Black Lung clinics. Probably in '78, I started working as a nurse at a local miners hospital. is what everybody called it. There was a few throughout the state and in Kentucky, and it's now called Appalachian Regional Health Systems in Beckley. But I became a medical nurse and worked on the floor, and this was a place where miners would come in, and when they had their flare-ups or their exacerbations, because they were having trouble breathing or had an infection, and they would sit up all night, being unable to breathe. And that's where I learned a lot about black lung, is talking to these miners at night on how the disease affected them, how it affected their families. So I went home and I was talking to my mom, because she grew up in Colwood and Bartley and West Virginia and coal camps her whole life. And her dad was a coal miner. All her brothers were coal miners. She even had one brother that was killed in the Bartley mine disaster. And there's a whole history of mine disasters in West Virginia. So she was giving me about the life there. So when I would talk to these miners, they were very proud about their work in the coal mines. And they talked about how short of breath they would get at work, and how it would get worse, and how work eventually became very difficult, and they felt like they were becoming a burden to their coworkers and to their families. And it's very common, because these miners, they don't want to stay home. They want to work. It doesn't matter what. You know, when they would talk about, they go to the doctor, their family doctor, they go for treatments. And that was only if they could be persuaded by someone in the family as their wife. And Debbie can probably attest to that years ago. And then they would get so short of breath or sick that they couldn't go back to work. And they were so sick that they couldn't get another job either. So, and they would often hear about these benefits, these black lung benefits that they could get. They would talk to other miners and widows, and they would tell them the stories about all the testing and the doctor's appointment that you've heard from Debbie and Susie and Jerry over and over, and a lot of paperwork. And then you would have to find a lawyer, and it was just very, very hard for them to even think about doing that. So a lot of times they would give up. They would go to their family physician and get their treatments and things like that. But a lot of times the family physician didn't want to get involved, because it consumed a lot of their time. There was a lot of paperwork. Maybe they didn't understand all the legal stuff. There might be hearings or phone depositions. And a lot of that was going on. So that was my first kind of education into being around coal miners that were really sick. At the hospital, they posted for a job in a black lung clinics program they were going to open. Well, I thought that was great, because I've been talking to all these miners and taking care of them on the night shift. And I just thought, that's what I want to do. Well, that's when I became I would say, a black lung clinic nurse, or started working directly with them. And that's where I met Dr. Rasmussen. He was our medical director at the hospital black lung program. And those of you that know Dr. Rasmussen, or if you don't, you should read about him, because he was a very strong advocate for the coal miners. And I learned a lot about him. He did, at that time, he was the director of our program. He did black lung exams, like Dr. Go does. He treated coal miners. He would help with benefits issues. As part of the clinic based in the hospital, we would go to the Community Health Center in Scarborough, and we would also go to another doctor's office in Sophia, West Virginia, Dr. Golden. And we would see their patients and work with the providers really close on what they needed, you know, what medications, how to take care of yourself. And it was always, the question was about benefits. So you had to learn about benefits, about what Susie was talking about, the different programs, the claims, the things like that. I think that was when I went to my first Black Lung Association meeting at the courthouse in Raleigh County. So that was a big eye opener. In '83, the hospital decided that they were going to close the Black Lung program and recommended a community health center take the program over. And that's when the program went to New River Health in Scarborough, West Virginia in '83. And I applied for that job and started working there. And it became evident working in Fayette County now on a full-time basis that a Black Lung Association was needed in Fayette County because there was a lot of legal issues with the claims process that you've heard about, and trying to get the medical treatment that sometimes they can't get, what Debbie was saying, because of benefits issues. The miner may not be working, they may not have money coming in, they may not have any health care coming in. So it was really to take care of the patient. It was something that was necessary. So we would, our board of directors, our clinic was formed by coal miners, and there was miners on our board of directors, and they were very supportive of our work with the miners. The Black Lung Association administration was very supportive. The staff, the providers, the mid-levels, the doctors, everybody was very supportive because we were a team at a community health center. So it became a very important part of our work, became working with the Black Lung Association. The legislative issues that Jerry was talking about, medical benefits, widows benefits. It was all very important. It was very important for the diagnosis of the patient, of the miner, the treatments for the miner, the education for the miner, pulmonary rehab for the coal miners, just a very better quality of life is what we were all working together to do. And as a Black Lung Clinics program and the Black Lung Association, we consider ourselves a team that works together for the miner to have a better quality of life. And that team includes the providers, doctors, mid-levels, nurses, respiratory therapists, medical assistants, outreach workers, benefits counselors. We're all considered a team. And it's like Dr. Go was saying, or maybe it was Susie, Debbie, or Jerry, that Black lung disease is not on the decline. It's not going away. It's still there. So it's important that we have good healthcare providers to provide this service to the coal miners. We need professional medical participants in our Black lung team, and that's my passion.
Thanks, Brenda.
Thank you.
Thanks everybody for the good questions. dropped into the chat. I'm going to share my screen again and just say a little piece about the current work of the Black Lung Association before getting over to the Q&A. So first, I just want to show a few pictures of just that this movement. Actually, let me jump back. This movement has been, alive for a long time, and it's a little bit the momentum of it, I think, has ebbed and flowed a bit. But as this photo shows, or these photos show that Leonard put up, the Farmington mine disaster was a real catalyst for the first real wave of grassroots energy that organized the Black Lung Association, and that won uniform federal regulations to try to account for Black lung, the prevention of the disease, the mitigation of the disease, and the provision of the medical resources needed to the miners who have it. This one here, Debbie Wills provided this to me. I believe it's maybe from probably maybe the early 90s or somewhere in there. Do you know if that's right, Debbie? If you can come off mute, Debbie Wills.
That might be the 80s.
But this
I had that photo.
Yeah. So this is an image from a bus trip of Black Lung Association members to Washington to lobby, which is a thing that has been happening for decades. Both the Clinic Association and the Black Lung Association, which is the miners organization, have been integral to keeping these issues on the radar of Congress and keeping policies, keeping a seat at the table for the policies that affect miners with Black lung. This here is from 2018. Jerry was talking about the trip that we took in 2018 and how we all got cleared out of the Senate office building before we were able to take the picture. Well, somebody was able to get this one. This was like moments before. You can see everybody kind of looking off to their right. I think they're looking at the Capitol Police approaching, saying, no, you have to disperse. You've had your meetings. You can't do this here now. But the organization has survived for a long time because because it needs to exist. And that's very sad that it needs to exist, but it does need to exist. And to demonstrate that need a little bit, this chart here shows the outstanding debt of the Black Lung Disability Trust Fund, the federal program that miners depend on for disability stipend when they are disabled and can no longer work, and for the medical care associated to Black lung disease. That's been, Jerry mentioned it, others spoke of it a little bit throughout the webinar today. This is a fund that is supported by a small tax on coal sales. It's not a tax on coal production because exported coal, this tax does not apply to it. It's a tax on coal sales, and that tax needs to be extended in order for the debt that this fund is in to be somewhat controlled. This shows the debt rising over the years. You can see that it drops a little bit right around here. This corresponds to a 2008 extension of the excise tax for 10 years. And then you can see around 2018, it starts climbing again. This projection is actually no longer accurate because from 2019 up until this past year, the hard work of the Black Lung Association and its supporters was successful in getting that small tax extended in 1-year increments. And as Jerry mentioned, it was not extended at the end of this year, which caused the tax rate that the coal companies pay, which is like 55 cents per ton of coal, to drop to 25 cents per ton of coal. So now that debt is skyrocketing. And that's a primary issue that the Black Lung Association is working on. And before kicking it back to the group, and I'll I'll set up some questions for folks. I just wanted to go ahead and thank everybody and share these links. One of the questions that was dropped in the chat was specifically asking for resources to learn more about, policy efforts and what's kind of on the table in federal and state legislatures, and how can people be involved in supporting minors. blacklungkills.org is primarily where I would direct you for that. That is a website that is maintained by Appalachian Citizens Law Center in Kentucky, an excellent organization, and it essentially functions as the Black Lung Association kind of action website. Whatever the current campaign is, that's kind of the place to go to get information. blacklungcoalition.org is the National Black Lung and Respiratory Clinics Association, and that's a really good place to go for information about the clinics and about the disease and the diagnostics and treatment of the disease and care for minors. appvoices.org, that's where I work. There's some information about Black Lung on there, particularly when we cover it in our publication called the Appalachian Voice. But mostly I'm just sharing that because that's my organization, but we work on quite a few different issues. And if anybody wants to follow up, has additional questions or thoughts that we don't get to today, there's my email address. And anyone who's registered will also receive a follow-up email from me. So with that, I want to call you back up, Jerry. If you could, there was some questions about the personal protective equipment that is used and worn in the mines. Could you speak a little bit to your experience with that as a miner? What kind of protective equipment y'all used? What were the rules around using it, and how effective was it?
Only thing we had was respirators you wore to keep the dust supposedly from breathing it. But it come to find out that most of the respirators that are supposed to catch the part of the dust that causes black lung, it didn't catch it. So wearing a respirator really didn't help you a whole lot. And it's back in, we just didn't have a lot of things pertaining your breathing part other than the respirator.
Can anyone else speak to the current state of protective equipment in the mines and how effective it is, and how compliant the miners are if it's used regularly, or if it's I've heard a lot of tales of it just being cumbersome, so not used sometimes.
I can't speak specifically about the state of kind of personal protection in coal mines, but I will say, as an occupational physician and scientist, personal protective equipment like respirators are a last line of defense. They're not as effective as other controls. There are water sprays, good ventilation, and these are the responsibilities of the employer, and that is probably not paid sufficient attention in many cases. But the use of a mask is imperfect. I mean, people have facial hair. The mask isn't going to fit properly. You have to wear it right every single day, as opposed to trying to reduce the amount of dust in the overall atmosphere. So I want to emphasize that part.
Yeah, thanks. Sorry, go ahead, Jerry.
Just like he was talking about the ventilation, it's in the coal mines, it's hard to keep your curtain, everything up, your water sprays when you miner. It's just hard to keep everything going, especially if you're on a long walk. And I know a lot of people hasn't seen it, but it's has a block of coal 1,000 foot long, and it starts from one end and goes to the other. And when it comes back to the tail, going back to the head, that's where you get all your dust at. And you take a shear that's probably 3 foot thick, taking a 1,000-foot pass down the longwall face, and you're going to get a lot of dust and protective stuff. I mean, when I worked in the mines, we didn't have a whole lot other than just like the doctor said, you know, you got to keep your water sprays up, your ventilation up, but your coal dust, you're never going to get rid of. I don't care how good you try. It's just so dusty. And now where the coal companies are getting this coal that they never wanted to get before because it's $400-500 a ton, they're taking like 2 foot more of rock than they used to take. And you take more rock, it's harder to get rid of the dust. You know, and I feel sorry for the younger guys because they don't understand what's going to happen to them when they stay in that much dust. You know, and we've talked to MSHA, you know, try to get them to reduce the dust standards. And we've talked to anybody that tried, but the coal companies doesn't care about the people. Only thing they're worrying about is how much money they can make. Yeah, you know, the dust, like I said, they're using the old equipment they had that was too high, in the high cold, and they're putting it in the low cold and trying to make, instead of saving money by buying low vein equipment, they're using high vein equipment, and you're taking a whole lot more rock than you should be taking. And the people is paying the price for it.
Thanks, guys. To put a finer point on what Leonard and Jerry are both saying, the standard, the allowable exposure limit for respirable coal mine dust in a mine, this is regulated by MSHA, Mine Safety and Health Administration, is 100 micrograms per cubic meter, I think it is. And that standard for any other industry, which would be regulated under OSHA, just because of a peculiarity in how workplaces are regulated in our country, mines are regulated differently. That standard for any other industry is 50 micrograms. So it is legal for coal miners to be subject to twice as high a level of respirable dust as workers in any other industry. And that's not okay. And that's an issue that the Black Lung Association is working on, and that Appalachian Citizens Law Center, who I mentioned before, has a petition to MSHA to change. And they, in their petition, they make the specific point that Dr. Go makes, which is that personal protective equipment is very important, and it is the last line of defense in a hierarchy of strategies to deal with dust. Dr. Go?
Oh, just a small clarification. The limits that you brought up, Willie, are specific to silica.
Oh, right.
The overall respirable dust limit in coal mines right now is 1.5 milligrams per cubic meter.
Right. And the reason silica is a particular concern in West Virginia, and Kentucky is because that is the area where current coal mining is starting to, or has for the past 20 years been, basically you have to cut through a lot more sand to access the coal, which is what it largely is believed to account for that spike in cases that is a little bit specific to our region. I don't know how, anybody can say that is 100% the cause, but that is a contributing factor that seems to be the consensus. Anybody else got anything on the personal protective equipment question? What about could anybody speak to the types of pulmonary rehabilitation, Jerry or anyone else, that miners utilize to try to maintain as much lung capacity as possible once afflicted with this disease? And how effective that is and how it kind of fits in with treatments. Susie?
So I'm at Cabin Creek Health, and we currently do federal black lung testing as well as pulmonary rehab here. We do have miners in our program. So if they get approved for federal Black lung benefits, that typically covers for them to go through pulmonary rehab. It's a 12-week program. They typically come 2 days a week for 2 hours at a time. And they are taught how to manage their disease and work out on the equipment. It's very heavily monitored. They have vitals before they start pulmonary rehab, vitals afterwards. They maintain their SAT levels throughout the time that they're here. But it's not only an exercise program, but a good education program for the coal miners. And it typically improves their quality of life, so to speak, but it doesn't have a huge effect on, it's not going to reverse the disease. They're still going to have the disease. They can just learn to manage that a little bit better and have a little better quality of life.
Thanks, Susie. And want to draw folks' attention to the chat as well, because in addition to questions, some of our participants are dropping some good information in there as well. So we had another couple of questions that were kind of along the lines of barriers to care, barriers to insurance. Do you guys have a lot of patients who are uninsured outright, or who are on Medicaid, or are minors still on insurance provided by their employers? What do y'all run into?
I think one of the things we find here is we do have a lot of them that have no insurance. They've made too much money and they've saved money, so they don't qualify for Medicaid. Their Medicare is not kicked in yet. So we try to help them with as many things as we can to get it paid for. So one of the things we've been utilizing lately is what's called the Lucas Bus. If they need a CT and they need that for part of their benefits, then if they've been a smoker and they fit in the guidelines, then we try to get them on the Lucas Bus. And that'll help take some of the expense off of them while they're trying to get their benefits taken care of and get more medical evidence. We try to give them samples of medications when we can. Anything that we can absorb here, excuse me, anything that we can absorb here in the clinic, we try to do that for them so that they don't have that much expenses. And then when they do have a partial claim through the state, if they've got enough award, a 30% or better, then we try to work with them to get some of this equipment and stuff paid for. Our doctors is really good about writing letters and showing medical necessity. And sometimes that works and sometimes it don't. It just depends on their claims examiner, or the person responsible. Sometimes it's not as hard to get things paid for as others.
I would like to add to what Debbie said. Our clinics were very fortunate to be in federally qualified health centers with sliding fee programs. So if the minor doesn't have insurance and we can't get them on anything else, we do have sliding fee programs based on their income and how many people live in the household. But a huge problem over the years has been, once the minor has disease and is having issues, they're very reluctant to leave their job because they do have very good paying jobs with very good insurance benefits. Where they have trouble is getting a day off to be able to come in for the testing. And they will not, they put their health on the line to be able to provide for their families. That's a huge part of what that's hugely a problem that we've seen over the years. I mean, these guys are very hardworking, very family dedicated, wonderful people to work with, who risk their lives all the time for their families.
Thanks, folks. I've got a couple more questions. We've got about 10 more minutes allotted. So if anyone else has questions, please drop them in the chat. Somebody asked earlier on when you were speaking, Dr. Go, and I don't know if you could speak to this or if Brenda or anyone else can, but was the impetus behind the Farmington mine disaster, was it just that it was an awful disaster that killed so many people, or were there like autopsies conducted that showed a prevalence of black lung that wasn't previously documented, or is there more of a black lung connection to that event?
No, that actually wasn't specifically a black lung event. There was, unlike there's a more recent mine disaster that was actually associated with a number of identified black lung cases, which is some of you may be familiar with Upper Big Branch, which happened in 2010. But Farmington in '68 was not associated with that. I think my understanding of the history there is that it was basically, kind of enough was enough at that point. It was about mine safety, but it was also, with various disasters that had actually preceded Farmington. But then also it was the issue of, at the time in the 60s, I believe the United Mine Workers had stated that there were an estimated 100,000 black lung cases. And that they were going unrecognized officially, and so it was kind of an enough is enough moment, and so the demonstrations began about black lung.
The last question we've got in the chat here is for you, Jerry, and you spoke to this a little bit, but one of the participants would just like to hear a little bit more, if you don't care, about how living with black lung impacts your everyday life and how you've kind of adapted, any ways that you've had to change your life to deal with these impacts.
People with black lung, you learn to pace yourself at anything you do in your life. Like carrying groceries in my house, and I had to probably go 100 feet. And with 2 bags of groceries or a bag of groceries, time I get them in the house, I got to stop and get my breath. But, black lung, just like the doctor said, you start out with it, and this doesn't bother you that much, and it progresses as you go along. And the more progressive it gets, is the more you understand. And it's like going to the clinics, to try to help you get some of your breathing back. It helps. But like I said, if you're planning your future for a retirement and everything, you will change if you get black lung, because you can't go out on the beaches and play with your kids. You can't go up the hills. I mean, it deprives you of so many things that people don't realize. And it pays good money. But the bad thing is, when you get black lung, if you don't watch out, it's going to cost you a lot of money. You take a case that's like mine for 8 years before it got settled, and your medicine and stuff, you just can't afford. But each person that has black lung, I'll tell you, they would give all their money back just to have their lungs back, because you just can't do the things that you really want to do. And I feel sorry for all the people that's got it. I've got it. I know what you're going through. And I just hope the people listens to what we're doing now. I hope they'll try to understand what we have, what we're fighting for, and anything that they can do to put out black lung for people to understand that we'll appreciate it. And I'd like to thank them for their time that they give us. And that's about all I got to say, really.
Thanks, Jerry, and thanks to all the panelists and all the participants. Don't have any more questions in the chat box. Did any of the other panelists have anything that's not been prompted that you'd like to share before we sign off here? All right, well then we'll give Jerry the last word. Thank you all again so much. And y'all can all look for a follow-up email from me, which will have some resources for how to stay informed and engaged in this issue. Thanks, everybody. Have a great day.